Hi, Professor Malillo. This is Kelsey Hurst, and I'm doing my project on hemostasis. Hemostasis begins where there is tissue damage that causes bleeding. The vascular phase is where local blood vessels near the damaged vessels and damaged tissue constrict to stop blood loss. The platelet phase is when the platelets activate and clump together to form a plug where the damage has occurred. Coagulation phase is when the fibrogen is converted to fibrin to form a mesh to trap platelets and red blood cells to form the clot. Clotting factors are proteins that play a role in blood clotting. Extrinsic pathway begins outside the bloodstream in the vessel wall. Factor 3 is also known as tissue factor and is released at the beginning of the extrinsic pathway. Factor 7 and calcium combine to form an enzyme that activates factor 10 during the extrinsic pathway. Intrinsic pathway begins inside the bloodstream. Factor 12 is exposed to the collagen fibers at the injury site. Factor 8 and 9 combine to form an enzyme to activate factor 10 in the intrinsic pathway. In the common pathway, factor 10 forms the enzyme prothrombinase, which converts to the proenzyme prothrombin, which converts to the enzyme thrombin. The liver needs vitamin K to synthesize for the clotting factors. A deficiency in vitamin K can result in the clotting system deactivating. Clot retraction occurs as a result of platelets contracting and pulling the torn edges of the vessel closer.